Yep, I can kick it off. Hi everyone, thank you for joining us today. Welcome to today's COVID-19 vaccination Your Questions Answered webinar, where we are joined by our local Merton healthcare professionals. So thank you so much for taking some time out of your Sunday to join us today. I just wanted to start off by saying this is the first of many sessions that we plan to run. It would be great to hear whether you find this session useful and get ideas to help develop further sessions. So if you do have any suggestions, please drop them in the chat box and feel free to email us following the session. Give us some ideas on what we can do next, what works. If there are any smaller groups that you'd like us to run, we can definitely look into that. And we'll also come back to this at the end. So today we're going to address facts about the COVID-19 vaccination, and it will be your opportunity to ask our health professionals any questions you might have. So I just wanted to cover some housekeeping. So because of the demand that we had for today's session, we're going to be recording this session and we're also live streaming it on YouTube for those that weren't able to register in time. So please keep your cameras off and stay muted. And if you do have a question, feel free to raise your hand or drop your question in the chat box. We're not going to take any questions during the presentation, so we can get through it as quickly as possible and really get down to those questions that you'd like to ask. And then Ben and I will start to go through the raised hands and the questions in the chat box, and we'll invite you to ask your question. Feel free to come off camera if you'd like to and ask your question. It's a reminder to also take yourself off mute. But if you do turn your camera on, please remember the session is being recorded and we're live streaming. So do whichever you do you feel most comfortable with. In terms of the view, we're going to be sharing a slide deck. In the top right hand corner, I think you can select your view preferences, and if you select speaker, then whoever's speaking will be larger on your screen, so you might prefer that. Thanks again for joining us, and I'm going to hand you over to Dr. Merton.
Excellent. Thanks a lot, Aman. And good afternoon, everyone. It's great to have you all here, and thank you for taking time to come today. I'm Dr. Mohan Sikra. I'm a GP in East of Merton. I'm also the East Merton locality lead. And it's a real pleasure to host or to chair today. We've got some fantastic sort of leaders and speakers joining us today, and I'll let them introduce themselves in a bit. And the aim today is to really identify what your questions are, so we can arm you with some data or some information so that you can make an informed decision about the COVID vaccination. There's certainly lots of questions being asked across Merton. We're planning to go for 1 hour today. We can extend depending on how things go. And as Aman was saying, please do put your questions in the chat box. So yeah, I mean, it's good. I'm good. We're good to move on to the next slide, Aman. So I think why we're here. So I thought there's lots of questions we can answer, and hopefully we can support that. So we're going to touch upon what COVID is, why are we using a vaccine, what's available, and what you can get in Merton and where our vaccination hubs are, and any possible side effects. And the idea is to get as much questions from you guys so we can support that. So we're going to keep this presentation as brief as possible. Next slide, please, Aman. So I'm going to introduce our speakers. Vasa, could you introduce yourself, please?
Hello, I'm Vasa. I'm a local GP. I've been working in the Lower Modern area since the mid-1990s, and currently I'm the GP Borough Lead for Merton.
Thank you, Vasa. I've introduced myself. Fiona, would you like to introduce yourself?
Yes, I'm Fiona White. I'm a nurse consultant, and I also work as a nurse practitioner in a GP practice in Morden. I'm currently working at one of the vaccination centres at the Wilson, so I'm live at the clinic today.
Excellent, thank you, Fiona. Sakib.
Hi, I'm just a GP. My name's Sakib Ayub. I'm a GP at the Collier's Wood Surgery and have been practicing there for the last 20 years.
Brilliant, thank you, Sakib. Adil?
Hi everyone, it's Dr. Adil Siddiqui. I'm a GP at River House Surgery in Wimbledon. I've been a GP for about 7 years, and day in, day out, I see patients and discuss issues regarding vaccination. Thank you.
Thank you, Adil. Aditi?
Hello everyone, I'm Aditi Shah, I'm a GP in Merton and also locality lead for West Merton.
And Sadina? Sadina, if you...
Hello, I'm Sadina. I'm the chief pharmacist for Merton, where I've been working for the last 20 years, and I spend a lot of time in the COVID vaccination clinics addressing patient concerns.
Great, thank you, Sadina. And Malik and Geeta, did you want to introduce yourself as well? Maybe start with Geeta.
Hi, I'm Geeta Maheshwaran. I'm director of the Sri Ganapati Temple in Wimbledon. I'm also chairman of the Wandsworth Community Empowerment Network and trustee of the London Borough's Faith Network.
Thank you, Geeta. And Malik?
Hi, I'm Malik Gul, work for the Wandsworth Community Empowerment Network. Very happy to be here because our intention is to run these seminars and forums again and again, and the next one and the ones after that, hopefully in Wandsworth. So happy to be here to participate and to learn. And also many colleagues from Wandsworth are also on this call as well.
Thank you, Malik. And Barry, did you want to quickly say hello from Public Health?
Hi, everybody. My name is Barry Causer, and I work in the Merton Council Public Health team. Hello.
Thank you, Barry. And as you can see, plenty of local leaders here to support your questions. So please do ask away and please do put them in the chat box. Can we move on to the next slide, please? So what is COVID? It's a new illness. Well, not so new now, but it is an illness which has been going on for the last 12 to 15 months. It affects people in very different ways, certainly makes you very poorly, and it can cause a lot of symptoms. I mean, the main ones are the continuous cough, loss in taste and smell, and a high temperature. And certainly those are three which we're asked to report. And currently there are 3.7 million cases in the UK as of the 28th of January, and there have been over 100,000 COVID-associated deaths in hospital and care homes. So a real factor going on at the moment. So that's why we're all here, and we want to answer your questions and support that. Thank you, Aman. So these slides are passed over by Public Health, Barry and the team. And so I kind of wanted to highlight, we wanted to highlight what the situation looks like in Merton. So there's a map of Merton, and certainly you can see in the east of the borough, so the darker areas show the higher rates of COVID infection. And so certainly in the east of Merton, there's a higher infectivity rate in comparison to the west, although in the west, there still is a high proportion as well. So it just gives you a flavour, certainly depending on which part of the borough you're from. Next slide. And this one's quite a busy slide, so I'll walk you through it. So I suppose the key figure, top right-hand corner, is 333. So they're the number of COVID-related deaths in Merton, certainly over the past year. And as you can see, in the first wave, there was a spike around the 11th of April. And now we're going through the second spike at the moment. The blue bars show the number of COVID deaths. And as you can see, there's also non-COVID related deaths. So it's important that you get a feel that actually while we're dealing with COVID cases, there's also the non-COVID cases, which is also being dealt with. So it's important that we put that into context as well. We're here to focus on the COVID vaccination, but it just gives you a rough estimate of what we're dealing with in Merton. Thank you, Aman. Next slide, please. So the good news is, based on those figures, so over 100,000 deaths in the UK and over 333 in Merton, you know, what can we do to support that? Certainly we've been having lockdowns, and we do have a vaccine which increases your immunity to the virus and reduces severity of the disease if you are infected. So that is good news. And at present, we don't know whether having the vaccine will prevent spread to other people. So you still need to wear a mask, wash your hands, and social distance, whether you are vaccinated or not. So it's really important that we do that. Some people are having vaccination and thinking that they don't need to follow those guidance. So it's really important. So I'm going to hand over now to Sadina to just talk about the vaccines and what we've got available. Sadina.
Thank you, Mohan. So in the UK, you'll know that we currently are using two vaccines in all of our vaccination clinics. So we have the Pfizer-BioNTech vaccine and the Oxford AstraZeneca vaccine. And in both of our clinics in Merton, we have both of those vaccines, though at any one time, we would have just one vaccine in the clinic in use. You would have also heard about the new vaccines, but at the moment, we haven't got the full information because it hasn't, but neither have been approved by the MHRA, which is the body that looks at the information on the vaccines and authorizes them for our use. But one thing you can be assured of is that the MHRA are very rigorous, and they will put these vaccines as they come through to them through all the tests to make sure that they're safe and they're effective for patients, so that whatever vaccine you get, you will be assured that that vaccine will be safe and effective for you.
Excellent. Thank you, Steve. And we can come back to any questions which may come around that a bit later on. Next slide, please. And Vasa, I think this one's over to you.
Thank you, Mohan. So this slide explains to you what we call the cohorts, how we go down the list at our practice to invite people onto the vaccination program. And it's important to dwell on it for a moment to say that this is derived on what happened in the first wave. So the aim of this is to try and get to those who are more likely to suffer serious, significant disease from COVID, or actually, sadly, even die from it. So that is the rationale for the basis of this cohorting. And we're going down this, and we're going down this pretty fast, Mohan, and I'm really proud about that in Merton. Next slide, please. And here we are. We have the two sites. I'm sure most of you know where the Wilson is in the east or where Nielsen is in the west. And both these sites are very active, and they're working at speed. And there are days where even we are given 1,000 in a single day vaccines. We also have St. George's, which is dealing with vaccination, and the two mass sites are Southwest London, Epsom, West Coast, and the Excel Centre. Thanks, Mohan.
Thank you, Vasa. Fiona, I was going to ask you, because you're in the actual hubs as we speak, about what happens to patients when they go to the vaccination centre. There's been a bit of anxiety around that. Could you explain that?
Yes, so when the patient arrives, they're welcomed by volunteers who have their details taken from them. We verify their date of birth and their name, and we give them a number, so they follow a sequential process in a queue. They are then socially distanced and line up ready for the vaccination, and then enter the vaccination area where they're met by a clinician who asks a series of questions. Those questions usually are they fit and well? We tell them which vaccine they're going to have on the day, either the Pfizer or the Astra, depending on what we're using on that day. We ask them if they've had a temperature, whether they've had the flu jab in the last 7 days, whether they're on a specific drug like warfarin, which we have to be more careful with. We ask them whether they've got any allergies to any drugs, medicine, vaccine, food, answer any queries about that. We ask them if they have been abroad, international travel, if they've had COVID in the last month, or had contact with a COVID positive patient. Then we ask their consent to give them the immunisation. We inform them that their GP will contact them within 12 weeks to have their second vaccine. We administer the vaccine, and we give them a card that has details of the vaccination they've been given. If it's the Pfizer vaccine, they have to wait 15 minutes. So they're signposted to a waiting area where they have to wait for 15 minutes. We log the time so that they know what time they've got to leave. We also give them information about the vaccine that they have been administered, and answer any clinical questions that they may have at the time.
Thank you, Fiona. Very thorough. So certainly really cared for once you enter the vaccination centre, and certainly social distancing while you're there in a nice, clean way. So next slide, please. So I thought now it'd be useful to ask our panel all to talk about some thoughts and many questions people had to identify and give you some information back about what some of the Vaxar. So the first one's actually going to be over to Sakib. Sakib.
Hi there. Well, I've been asked to speak about the myth that if I have the vaccine, I don't have to follow the restrictions. So that is actually not true. You need to continue to follow all of the official guidance after you've been vaccinated, and this protects you and other people. There are several reasons for this. The first is that the vaccine works by training the body's immune system to recognize the virus and to fight it if it encounters it in the future. So this process starts at about 2 weeks after taking the vaccine. So it's not immediate. And clearly, therefore, you'd need to take extra precautions, but also you need to carry on taking the precautions because it will protect people who may not have been properly immunized or who haven't yet had the vaccination, because the vaccines, they are highly effective, much more so than the flu is for the flu. The flu jab is for the flu vaccine, preventing people from becoming ill or dying from it, from COVID-19. But there's no vaccine that's 100% effective. And clearly there will be individuals with a weak immune system who just don't develop the desired immunity, and they will always be potentially vulnerable. We also don't yet know how or if to what extent the vaccine reduces the risk of, vaccine reduces the risk of people passing the virus on to others. And research is underway to answer this question. Some people, of course, may not be able to have the vaccine at all, and therefore the guidance must be continued. So clearly, hands, face, and space are going to be sort of a very medium to long-term way of dealing with prevention of spread of infection. Of course, as we know that there are new strains and variants of the virus, and again, we don't know in future if any of the current vaccines will have protection against those. So hands, face, and space are still very important. So that's one myth. I was also asked to briefly touch upon another, and being a Muslim and having had the vaccine myself, I had the Pfizer vaccine about 4 weeks ago. And so there is a myth going around that vaccines are haram. Well, haram meaning forbidden. So declaring a product as halal or haram is a call for Islamic scholars. And they've studied this problem for years, this issue for years, and the simple sort of presence of an ingredient is not the only factor that you take into account. So most previous vaccines, including the Pfizer vaccine, have been declared halal by the majority of scholarly bodies worldwide. The final decision is obviously the responsibility of the individual, but you need to ask a trusted local scholar for that. My colleague, Dr. Siddiqui, may elaborate further on this point. Thank you.
Thank you, Sakib. Thank you very much. Aditi, I want to ask you about the second point, if I may.
Thank you. So I've been asked about if you want to start a family, what you should do about having the vaccine. So to reassure you, there is no evidence to suggest that the vaccine causes any issues with fertility. In some people, they may choose to have it in pregnancy and breastfeeding. So if you are a frontline health or social care worker, or if you have an underlying health condition which makes you much more vulnerable, then you may choose it if you're breastfeeding or pregnant as well. But just to reassure you, at the moment, there is no evidence to suggest it has any impact on fertility. Thank you,
Aditi. Did you have a second? Did you have anything else you wanted to? If I move on to. Okay, Adil.
Oh, thanks, Mohan. Majil. So my question is, can you have vaccine if you have an allergy? It's a very important question, and I think we need to go into slight detail into this one, because many people might not want to take the vaccine because of the risk associated with the vaccine. To be honest, the answer is both the vaccines are very safe. It has gone through a lot of safety checks through the MHRA regulations, and they're pretty safe. But few things I want to go into initially is we are talking about allergies. So we have to discuss about types of allergies. One is something called severe anaphylactic reaction. Okay, it's a kind of reaction where if you had it, you would know it, because you would be in the hospital with anaphylaxis. It's a severe reaction where you might have had lip swelling, difficulty in breathing, severe rash on the body, and you might have had called ambulance. Okay, you might have had the treatment in the hospital, and you would have ended up with some injection called EpiPen, which is to treat anaphylaxis. So that's a severe kind of an anaphylaxis reaction, which we have to consider in choosing the vaccine. The second thing is non-serious allergic reaction, which is mild reaction, which can happen with any medicine like drugs, food, sting bite from an insect, those sort of things. If it is mild reaction, the general consensus is most of the vaccines are fine. You can have either Pfizer or you can have Oxford vaccination. But if it comes to anaphylaxis with a severe kind of reaction, then you would have to speak to a GP, have a detailed chat, whether it is the right vaccine to have, which one is the right vaccine to have. Can I have the next slide, Mohan? I'll just go through the ingredients as well. So the important thing is, looking at the ingredients. The reason is it decides what vaccine you're going to choose. These are the ingredients in Pfizer vaccine on the left side, and on the right side is the Oxford vaccination ingredients. Most of these ingredients are pretty safe, okay? And those people who had reaction to these ingredients, they can't have the vaccine. And there will be very tiny percentage of patient population of people, who had reactions. The question would be, how would I know this? I'm allergic to these components, these ingredients. If you had allergy to these ones, you might have been tested in the past. You have gone through the specialist, investigation for allergies, and you would have had this on your medical records that you're allergic to these components. But it's very rare. These are very rare side effects or the allergies to the vaccination. I just want to touch upon the background of these ingredients. It's very clear that there's no material of fetal origin or animal origin. As Saqib was saying, it has been approved, for halal and permissible use by both the Muslims as well as the Jewish group. And if you want any information about this in further detail, you can go to British Islamic Medical Association website, and the other one is the European Rabbi Conference website. Either of these. So there's a pretty good consensus, and it's a uniform consensus from most of the majority of the scholars who have agreed for the vaccination. So I have slightly deviated to the other side. With the allergies, there's pretty good documentation on the public health websites, which vaccination to use and which to avoid. I can already see two questions. The first two questions about the allergies. Pretty interesting to go ahead to see these questions here. If you should avoid, as I said, you should avoid the vaccination for which you have got the allergies to these components. Okay. If you had taken one vaccination and if you had developed severe allergic reaction to that vaccine, you will have to avoid that. The second dose will have to be the other vaccine. Okay, that's the second thing. Third, very rare aspect of vaccination is something called biologics or monoclonal injections. These are medicines which are used in certain conditions for some rare conditions, and for that you will have to discuss with your specialist. These are biologics or monoclonal injections, and if people had reactions to these medicines, they can't have the vaccination. The first question was about, somebody mentioned they had allergies to 3 antibiotics and they were given Pfizer. So I would have needed more clarification. Initially, when the Pfizer was introduced, there were few reactions to, severe allergic reactions to people who already had severe allergic reactions in the past. So they changed their guidelines immediately, and we were told that, if somebody has got multi-drug allergies, more than 2 allergies, two drugs causing allergies, they should avoid preferably Pfizer and try the other one, which is the Oxford vaccination. Okay, if somebody has an unexplained anaphylaxis, you don't know what caused anaphylaxis, which is rare because you would have had some tests for that. So you should avoid Pfizer and go to Oxford AstraZeneca vaccination. I know too many things to discuss, but if you want to ask questions again, then we can go through it as well.
We need to stress here also, it'll be the GP that you need to speak to.
Absolutely.
And
You
who
need
will
to
make
contact
the
the GP
decision for you about which vaccine to take.
That's right. Absolutely. And one important thing is, with Pfizer, there's an exception. Even if you had anaphylaxis to food, some drugs, bee sting, you can still have Pfizer vaccine. Okay, but you have got a choice. If you're worried, you can speak to the GP. You can get the AZ AstraZeneca vaccine. And the last few things about the precautions I would like to say: if somebody develops mild rash with the first dose of Pfizer, you can still have the second dose, but it will be in the hospital. So you'll have to speak to the hospital, speak to the GP, arrange for the hospital. The other option, which is, I think, makes logical sense, is get the second dose as Oxford vaccination instead of going to the hospital, which can be given in the primary care. Okay. And the last thing is, if you have got any non-allergic reactions like fainting episode after an injection, it's not an allergy. So you can still continue with the second dose. Finally, I would like to give an important, myth buster is basically none of the ingredients is going to change your DNA. They don't have any microchips in it. They're not going to trace you. Okay, they're not going to grow beard on females, and they're not going to cause infertility. These have been the myths in the WhatsApp groups. You must have all had it. So I hope it helps. Thank you.
Thank you, Adil. Very informative and very helpful. If we can move on to the next slide, and I think it's Adina who's going to be picking up number 4.
Okay, so as Saqib said in the beginning, even after you've had the COVID vaccination, you still need to adhere to the restrictions because yes, you could still get COVID-19 after having both doses of the vaccines. And that is because vaccines are not 100% effective in preventing you from getting an infection. What the vaccine will be doing will be training your body to handle the vaccine, handle the virus when you are exposed to it, so that your exposure will lead to a infection that is less severe. So yes, you can still get COVID-19 after having both of those doses, but that will mainly be because you may not have adhered to the restrictions. You've still exposed yourself to the virus. So the key thing is, even after you've had your vaccination, you must still adhere to the restrictions. You must still wear a mask, wash your hands, and social distance.
Thank you, Sadina. And Vasa, I was wondering if you could talk to us about the final point.
Thank you, Mohan. But before I start, Mohan, can you permit me to thank Geeta and Malik for their sterling effort? If not for them, I would not have reached this audience, and I'm really indebted to them for this. And I think we also have to put this in perspective that the people attending today, I don't consider them attendees. I consider them vaccine ambassadors for South East London, because our role here is to create ambassadors for us to get this good message, the beacon of hope, out to the community, so that no one out there should miss this golden chance to save themselves and their family and their community of the misery of severe COVID, leave alone death by COVID. So let me remind all of you, no question is too simple for you to ask. All doubts have a reason. Every concern needs an answer. And it is by challenging each other that we make progress in science as well as in society. And let's remember that as we go on to the answering questions part of this webinar. Mohan, before I answer this question, permit me to put this in context. When I look at the deaths of January 2021, 1,000 a day for a while, when I go to work and I'm informed of the people who have passed away the previous day or the previous week in my practice, some of them I have known for 25 years and I never had the chance to say bye. When I hear from families who have lost their relatives, asking to be vaccinated today rather than wait for their turn in the cohort 2 weeks later, I wish this vaccine came in November. We could have got there sooner. When I hear about people who tell me they have a parent in one ITU or a spouse or a sibling in another ITU, in another hospital, in another part of England, I wish this vaccine came in November too. When I look at the faces of hospital staff, some of whom I worked with in my younger days, some of the consultants whom I deal with regularly in my capacity as chair, they don't say anything, but their face speaks 1,000 words. And I wish this vaccine was there in November, to bear them, the burden, the pain, things they have seen, the emotions they have gone through, and what they have done. Those who went to work every day so that you and I may live. I think then too, I wish the vaccine came in November. Sadly, it didn't. So Mohan, the proof of our gratitude is not in the clapping. It is in the vaccinating. I really mean this. I cannot see it any other way, Mohan. Then I wake up from my dreams and say, no, we cannot compromise on safety. Emotion is the enemy of reasoning and judgment. The vaccine could not have come in November. It had to go through the process of regulatory scrutiny, the governance, the diligence. And that is why reality that it came in December. So to answer your question now from a scientific point of view, but I can't be divorced of emotion. That's why I gave you my other answer first. In the ideal world, I will say to you, Mohan, things take far too long. All of us can agree that we do not live in an ideal world, not for the last year. So in the real world we live in today, we can say that pharma did not start from scratch. They had the platform technology already available to them. All they had to do was wait for the genetic code of the vaccine and use the platform technology to develop this at speed. They were funded. The amount of funding they received is monumental in the history of funding. They were told the product will be purchased, and they put all the efforts into this, and they collaborated, they shared the genetic code data, the scientists spoke to each other, and that is why the hospitals were able to recruit patients into the trials. You and I know many clinicians, including those from ethnic origin, minority ethnic origin, enlisted, and I use the word enlist because they didn't volunteer, they enlisted to participate in the vaccine trials, knowing that they were entering unknown territory. Those unknown territory colleagues of ours who participated in the trials made it safe for us because now we have data from April, May, July, August onwards. Come December, we know for sure that the regulatory authorities have checked it. They didn't rush anything. They were very diligent. And now we know this was never rushed. Mohan, let me end. A famous man from a jail in Birmingham, Alabama, once said, injustice somewhere is injustice everywhere. I say to you, Mohan, COVID somewhere is COVID everywhere. Let's pay homage to Martin Luther King and get rid of this nasty virus. Because it's affecting us and it is affecting those from the BAME communities more. So to me, this program, Mohan, is a good Samaritan act where we do this not for ourselves, for our families, our communities, and for those staff in NHS who go, as I said earlier, who go to work knowing that they may fall at work so that we may live. Now you asked me to answer a second thing. The second thing I may answer is the thing about this gap. Why was the gap between dose 1 and dose 2 changed? If you go back to the data you shared, Mohan, in January, we realized that we were seeing numbers which none of us ever wished to see. Having seen those numbers, it would be inhumane not to change an existing policy. If you had 2 vaccines in your hand and you had your mom and dad in front of you, would you give both of them 1 each? Or would you choose at that point to give only one parent 2 and let the other one chance it? I think the answer is obvious. Knowing that 1 is enough for the time being, they're only postponing it by 12 weeks. I see no other way of dealing with the numbers we dealt with. The hospitals were at breaking point and we had to do something. And therefore, as a clinician, I'm absolutely comfortable because I understand the rationale for the change. Going back to my previous comment, if I lived in an ideal world, we would never have changed it. But as you said earlier, it's nearly a year since I saw that ideal world, Mohan.
Thank you, Vasa. Thank you, Vasa. And I think you answered one of the questions there, which is on the chat group. I think we're going to probably move on now to any questions you guys want to say. So if we move on to the next slide, or does that unshare screen? Yeah, and now I think we can probably open it up to questions you had. And one of the questions I think Vass has answered about the 12-week gap. The second one I've seen, which is quite a few questions have asked, is about mixing Pfizer and AstraZeneca. So I might ask Sedina that question if she could answer that.
So at the moment, if you've had the Pfizer vaccine first, your second dose will be Pfizer. And if you've had the AZ vaccine first, your second dose will be AZ. There is no directive at the moment that allows us to mix the vaccines. And so for now, we will stick to giving you the same vaccine you had the first time when you have your second dose.
Excellent. Thank you, Sedina. And there was a question on, Aditi's picked up on pregnancy. Aditi, did you want to pick up on the pregnancy question?
Thank you. So I think there was a question around if you're thinking about getting pregnant, what to do about the vaccine. And the answer is that you can have the vaccine, you don't need to avoid thinking about getting pregnant. And it's really important to protect yourself. The thing is that people who are of BAME groups, if they do get pregnant and they get COVID, then sometimes COVID can be more severe if you're pregnant. There were studies done which show that if you're pregnant and you're BAME, you're overweight, or you're older in pregnancy, and you get COVID-19, then it can be more severe in that group. So absolutely fine if you're thinking about getting pregnant to get the vaccine. It is better to protect yourself in that way. I hope that answers that question.
Thank you, Aditi. Vasa, you've got your hand up. Did you want to add to that? And you're on mute as well. Can you unmute yourself? Yeah.
Thanks, Mohan. Mohan, I think I can answer some of the questions which are coming up on the chat till the others pick them up. So the question about, do we keep a list? Yes, we have a strict policy in both vaccine centers. Fiona will vouch for this. We do not believe a single vaccine should go waste. And therefore, we do have a list. The doctors and the nurses and the pharmacists on site, they're all local clinicians. And therefore, the last minute, we do call people in. And so far, no one has complained that they were given 10 minutes to get to the site. And therefore, we are definitely using that list in real life to ensure A, the people who need it are getting it, and B, that we do not put a single vaccine in the bin.
Thank you, Vasa. Another theme which has come up is being around the proportion of BME affected by COVID and proportion who have received the vaccine. Barry, do you mind if I ask you that question?
Yeah, thank you, Mohan. And it's a really important question for us. And with us in the local public health team, we are looking at the data every single day. We get the numbers of cases, we get the number of positive cases, and we're looking at this from a public health intelligence point. So what we are seeing within Merton, we are seeing signals that there are more cases in BME communities. The data is emerging, and so what we have promised to do within the borough team, in the public health team, is to deliver a webinar where we present all of the data that we have so far to our communities so that we can use that to work with you to develop our response. So direct answer to the question is yes, there are more cases, unfortunately, in BAME groups within Merton. They are increasingly higher in the east than the west of the borough, and we are developing presentations, and we can have continuing ongoing conversations about what that data means and how we can work closely with you to reduce and mitigate against that impact.
Thank you, Barry. I'm just going to work my way down the questions, and so the first two are around allergies. Fiona, I was going to ask you the question around complex chromosomal abnormality, and I know there's a piece of work going on with learning disabilities. Are you able to elaborate how we're approaching that in Merton?
Yes, so currently we are making sure that all clients that have a learning disability are offered the COVID vaccine, especially those with the highest risk, like those that have got Down syndrome. So practices have made sure that they are appropriately coded, and they have been invited to either attend the Wilson or the Nelson. If they have a specific need, and they would find it very difficult or stressful in the venue here, then we have made adjustments for that. We have immunized in a car, which was very welcomely received by the parents and also by the client, who didn't seem to get too distressed about it. We are also making sure that as many clients as possible can be immunized as part of the home visiting service. So GP practices can go and do a home visit if that's appropriate, or we'll put on a specific learning disability clinic here, either at the Wilson or the Nelson, with the learning disability team as the volunteers that will help guide clients through the service quickly and as with the least amount of distress possible, because they are known to the learning disability team. But we will make reasonable adjustments that are required to meet the needs of the clients.
Thank you, Fiona. Thank you, Fiona. Saqib, did you want to add to that?
Hi, yes. Thank you, Fiona, for that. I think just following on from Fiona's question, there's a answer. There's a really interesting question in the chat saying, my daughter has complex chromosomal abnormality that has resulted in global developmental delay. She's 39 and lacks capacity. I have to make a decision for her. Currently, I'm erring on no vaccine. I need to be convinced, query. So that's a really, interesting ethical scenario, and I'm really sorry for that situation. I think this requires greater knowledge of the exact situation, but the ethical principles are, firstly, we must do no harm as doctors, and therefore we've got a duty of care to do our best. And in this scenario, there is potential harm for exposure to sort of the coronavirus, but we also have to do good for the patient, this concept of beneficence. We also have to consider the quality of life. So no matter how much disability or developmental delay there is in an individual, they do have some quality of life which they may enjoy, even if it's food, for example. But we also have to look at the law, and we have to do whatever is in the best interests of that individual if they lack capacity. So best interest decision needs to be sought. And people with such problems may have, in fact, increased risk of COVID. And we can't decide to withhold a treatment or vaccination in this case just because they have a developmental delay. I think all people should be treated equally. That's my view, but obviously this is a very complex case, and every case is individual, and it's very difficult to answer. I don't know whether any of my colleagues would share any further thoughts.
I think Vasa, did you? Yeah, Vasa, yeah, over to you.
Absolutely, Saqib. These are difficult, highly emotive decision-making situations. But this is what Saqib, you and I are here to do, and to help families reach the point where everybody is satisfied with whatever decision they take. Now, we have done this for years with our older patients, with end-of-life care planning, with advanced care planning, where we have equally sensitive decisions, and we use the same ethical framework to come to the point of those who lack the ability for autonomous decision-making. How do we arrive at best interest decision-making? It is by open, transparent discussions of the truth about the price we pay for acting, compare that with the price we pay for what we are not doing. So sometimes not doing can be more harmful than doing something. And to me, in this context, one has to look at how will this person, the mother, the father, the carer of this person knows this person far more than you and I will ever do. So they will know if we don't immunize and if they fall ill, how painful and traumatic it can be for that particular individual. Some people do not like hospitals. Some people do not like doctors. Some people do not like hospital environments. And to me, despite having worked in hospital, when I look at those hospital pictures of the noise, the people wearing, if you don't mind me, uniforms with masks and visors, that's pretty scary and scaring. And I think you have to balance. What am I going to lose by vaccinating against what am I going to gain by vaccinating? And then you come to the best interest decision for that person by the people who know that person the best. And we must not divert from that. COVID should not alter our fundamental ethical principles and values and judgments and the processes. There's no excuse whatsoever to throw away what we have always done in this situation. We just have to apply it, be more open, and give time to people to arrive at the right decision.
Thank you, Vasa. And I can see lots and lots and lots of questions on the web chat, so keep them coming along. We've also got questions coming on the YouTube aspect as well. We were going to do an hour, but I think we'll extend to 7 if the panel are happy to extend another half an hour. So still, please do ask your questions, and we will do a frequency asked questions as well. So please do keep those questions on that. And it sounds like we may we'll repeat the session as well. So we've got a few got their hands up. Adil, did you want to come in here?
I think Vasa wants to say something. Vasa, do you
no,
want to go ahead
no,
first?
Adil, I'll let you go.
Okay. Yeah. Two questions I've got, Mohan. One is clinical, about what about those people who had COVID infection already and the presence of antibodies, whether they should get the vaccination? Very interesting and important question. COVID, as we all know, is completely new disease, and research is still ongoing for many aspects of the disease. Antibodies have been detected, and we expect the antibodies to last 6 months, but we don't know how effective these antibodies are. Okay, and we have already seen, people getting COVID second time as well. Okay, not many, but few of them. So we can't just leave as it is. We need to vaccinate everyone. Even if they have got COVID infection in the past, they need to get the vaccination as well, if they fall into the group which is being vaccinated right now. If the guidelines also suggest that, if somebody had COVID infection within 28 days, not to vaccinate. It's not because there's any clinical reason, but because if the condition deteriorates from COVID infection itself, it will be wrongly contributed to the vaccination. So ideally not to get within 28 days. I hope this answers the question. The second one was about whether we will get certificate at the end of 2 doses of vaccination. I hope we could, but at least we are getting some stickers, I think, when we get the vaccination done at the center as a star sticker. But you can, if you want proof of your vaccination, you can ask your GP, because the information goes down to the your GP. I hope it helps. Thank you.
Thank you, Adil. Vasa, did you want to come back in?
Yes, there was a question about herbs. And if you see my name, you probably will realize that there is not a single day which has passed in my life, whether my grandmother cooked for me, or my mother cooked for me, or whether my wife cooked for me. There cannot be a single day which would have passed, apart from the time I've been on holiday. And you know what? When we're on holiday, after about the 7th day, my children will say, "Mommy, when we get home, can we have chicken curry, please?" Because they are missing the herbs. So herbs is part of my life. And therefore that question about herbs and COVID-19, yeah, there's nothing wrong with herbs. There's nothing wrong in doing herbs and the vaccine. Only thing about herbs I will say is certain natural material, including St. John's wort, does interfere with some of the prescribed medication. So as long as you're taking something you've already taken, and you take it in reasonable, normal quantities rather than mega exaggerated quantities, I see no reason why anybody should forego herbs just because we come along with the vaccine.
Thank you, Vasa. And I think that was a question from the YouTube connection. There is another question on extremely vulnerable category. Some still haven't been invited. Has anyone want to take that question? Sort of how we're working our way down the clinically. Adil, you got your hand up?
Yeah, just want to reassure everyone that there's a lot of hard work going on, from GPs, GP staff, practice managers, the volunteers, they're all putting their efforts to, make sure that everyone gets vaccination as soon as possible. So we are proactively contacting the patients, sending them text messages, and we've got volunteers who are actively calling the patients if they have not responded to the text messages as well. So if somebody has not been called, and if you feel that they are in extremely vulnerable group, please contact your GP and find out, when they're going to get it and the reason why they have not got it done.
Thank you, Adil, and I would echo that. So I'm involved in supporting volunteers with the COVID programme as well. And as I mentioned on the graph, there's a lot of non-COVID work, so there's a lot of normal long-term conditions we're looking after and COVID patients as well. So we're using a lot of our resources to call patients up, and also volunteers are helping with that bit as well, which has been really, really helpful. So we are working really hard in terms of getting everyone a contact, either by email or a text or a letter as well. I've got a question on here about how long immunity lasts after both doses. Anyone here who wants to take that question?
Yeah, I can take it if nobody's.
Maybe if I ask Sadina first, and then we'll come over to you, Adil.
Yeah. So at the moment, these vaccines are new. And we know that we need to give the second dose to improve their immunity. What we don't know yet is how long the immunity that we develop will last. And the patients that were in the trials are still being followed up. So new information is coming out all the time. And at the moment, all we know is that when we have the vaccine, we develop very good immunity. As to how long that immunity will last, only time will tell. But at the end of the day, it is going to be far better to have some immunity now than no immunity at all. So we need to have the vaccine. We need to learn as we go along. And as things change, the science will change, the vaccine programs will change to mimic that, to get the best out of the vaccine.
Thank you, Sadina. Adil, did you want to add to that?
I completely echo. Sadina has covered everything. The last document I read was, it could last 6 to 12 months. That's what we are expecting. Hopefully in future we might know that it can last longer. I hope so.
Excellent. Thank you. Thank you both. Oh, Sakib.
Just following on from that, we do know that having had COVID before, that doesn't necessarily protect you from having COVID again. And there have been cases of COVID in people who've already previously had it, so recurrence. But we also know that in the vast majority of those, the actual symptoms are far milder. Therefore, immunity, even if there is some, does confer an advantage in a reduced amount of symptoms, and one would, reasonably and logically translate that to the vaccination program. So if you've had the vaccine, although the immunity wanes, one would expect a milder illness if there is a recurrence.
Excellent. Thank you, Sakib. Ben just mentioned that he's got all the questions recorded on a Word document, so we will be answering them on an FAQ on our website, just because if we don't answer them all, we will try and get through as many as we can. Vasa, did you want to come back in?
Yes, there's a question, Mohan, on wheelchair. Absolutely vital question to ask, and we need to answer it today. Wheelchair access at the Wilson site, absolutely. There's no problem about it. There is wheelchair access, definitely, at the Wilson site.
And there is at the Nelson site too.
Sorry, Serena, I should have said both sides. Sorry.
Thank you.
My bias came through on that.
Aditi.
Can I just add to that? So I was at the vaccination site yesterday, and the volunteers are really helpful. So if you are in any way struggling, whether it be you're just not sure where you're going, or if you have a wheelchair, or if there's another accessibility issue that you're worried about, the volunteers are there to help you and guide you, and they're really knowledgeable, and we are so grateful for their contribution to our community. So just to reassure you that they are there for that purpose. Perhaps I could pick up on a couple of the other questions, Mohan, if that's okay?
Of course, yeah. Sure.
So I think there was a question about children and vaccination. So at the moment, the vaccinations are not being given to children. You've got the vaccinations are licensed, the COVID vaccination for over 16 years of age. So I think there was a question about a 13-year-old and which vaccination they should choose. So at this moment in time, we're not vaccinating children in that way. In terms of the side effects, now everybody is very different. I'll give you a personal example. My husband and I just happened to have the vaccine on the same day. And my husband didn't have any side effects at all. He just had a little bit of muscle pain and was looking after our very active kids the following day. I had a little bit of arm ache. I had a slight fever. I felt really tired. And that meant that he had to look after the children and I got to lie down for a little while. And slightly different side effects. But ultimately, they resolved fairly quickly within a couple of days, and I was completely fine after that. And my point is that everybody is different, and there are common side effects that you may encounter, such as the stiff arm, perhaps a little bit of a fever, perhaps a bit of a headache. And a little bit of localized reaction on the arm itself. But most people manage these side effects very well. You can always keep some paracetamol at home if you need to, and then it's accessible for you if you need to take it. In my case, I just made sure that my other half was there to look after the children, just to give myself a little bit of rest as well. So if you have young ones and that's all someone you're caring for, then it's just something to bear in mind, having that little bit of a extra help at that stage.
Thank you, Aditi, and I would echo the support from the volunteers has been absolutely fantastic, and there's a few on this webinar I can see, so that's great to see as well. Just following on from what Aditi said about the side effects, and there's a follow-on question about when to contact 111. Fiona, did you want to answer that one in terms of when sort of patients, if they have the vaccine, what they should do if the symptoms persist?
Yes, so generally when we immunise somebody, we do say they might get a localised reaction in the injection site. They might get a headache the next day. They might get a few aches and pains. But if they get a high fever above 38 or become unwell, then they should contact either 111 or their GP. That's what we say.
Excellent, thank you. And we have got a mechanism of, if the reactions are severe, that we record them on the yellow card system. We would, yes. They contact their GP and they would document it for them because it needs to go in their notes. Excellent, thank you. There's a question here on accessibility of vaccine sites. I know Vasa touched on wheelchairs. Was there anything else to that, Aman? Or was it mainly around the wheelchairs?
Was mainly around wheelchairs, but also there have been some questions about individuals with visual impairments and what sort of support they might get at the sites.
So certainly, as Aditi said, we've got sort of volunteers at the start of the hub site. I'm doing a video actually to show what the journey looks like with Ben. Ben's helped me with that in terms of what happens when they enter the hub to the actual medication centre and then on their way out as well. And the volunteers are wearing these high-vis fluorescent tops, and there's often about 2 of them at the front desk, so they will be able to kind of support you, and certainly if assistance is needed, they'll be able to provide that. There has been circumstances where the patients have been quite immobile and not be able to walk very far, and so the vaccinator has actually come out and done the vaccinating sort of by the front door. We haven't done it for everyone. We've also said that if patients can come on their own, great. If they need support, then we've been letting them in. Obviously, we want to reduce the number of people who are in the vaccination centres just because of risks of COVID and overcrowding as well. So certainly plenty of support down at the vaccination hubs, and the volunteers have been fantastic. Vasa, you're mute, Vasa. Vasa, you're on mute.
With regard to accessibility, Mohan, as you said about wheelchair and visual impairment, the frailty, we have seen a lot of frailty when we first did the over 80. And my good friend Fiona out here is also an expert in vaccinating people in their cars who can't get out of their car. So ask the Marshal, is Fiona here today?
Thank you, Vasa. I'm always happy to help. We will make reasonable adjustments for anybody. And often they come in their mobility scooters, and I get very jealous because they whiz in and they whiz out. The only other thing I'd like to say is that the volunteers are absolutely fantastic, really fantastic. And some of the clients that do come, patients come, not only have visual impairment, but they have hearing impairment. So we do give them written information so that they can see and have some of their questions answered. And I think that's really helpful. And we also have needle phobic patients. And if they tell us, we support them, you know, we will reassure them, maybe take them to a side room and support them and do it as quickly as possible. And often a lot of them are actually amazed because they think, have you done it yet? You've done it before they've even, you know, got in a state about it. So, you know, we will make adjustments for people who are worried. And that's there.
Thank you, Fiona. Geeta, I wanted to bring yourself and Malik in, actually, if you had any things you wanted to raise, possibly about commitment to getting information to BAME groups in a meaningful way, or any other concerns you may have heard anywhere.
I think what we're looking for, I mean, this has been a fantastic webinar for us to hear back from the general public and our communities. We're really keen to ensure that the information that we've covered today and more goes to as many communities, as many individuals as possible. So for those who are on this webinar, please, we're planning 2 further webinars as well, which will cover the same things and more if you wish. So please spread the news to friends, family, loved ones, anyone who needs the information. It's not just about those who are concerned about the vaccine, it's also those who are seeing all the misinformation out there and just want to get the facts, the true facts, so that they can counteract any untruth that's out there at the moment. So the way we're trying to do it is we're doing general webinars like this. If specific communities want to have their own individual webinars, we have amazing doctors, many of them that you can see here, but within Merton, we've got the United Nations there in the GPs that we have there. We have those who speak many different languages. I know Mohan Surgery has, I think, about 10 languages spoken by all their GPs and nurses there. So we can get people who can speak in the language of your choice, and we can do a specific targeted webinar for your community. So please let us know. Feedback to Aman. We've got the CCG email, so just send it back. She and BJ are fantastic. They will collate all the information and then organize webinars so that we can get the information out to as many people as possible. So please do feedback. If there are other questions, please put them on the chat or just email through, and we'll do everything we can to get the information out to everybody. We're also doing films, which will be put on the CCG website as well as the council website, hopefully, which will be in different languages with different faces, so that as many people as possible can get the information that they need from them as well.
Excellent, thank you, Geeta. Vasa.
Mohan, it's very important to hear what Geeta just said. When people ask us to come and meet them, don't for a moment think you're asking me to do you a favor. You are doing me a favor by inviting me to come and talk to you. So have no reservation. In the past, I'm sorry, we have not come out and we have not spoken to you in a language of your choice or in a venue of your choice. But let me apologize for that and say from where we are today going forward, we will rectify that. And part of that journey begins today. So don't be hesitant. If you want us to come and speak to you in a particular place, in a particular language, just ask and we will do our best to find the clinicians. Some of them may not be very fluent in their original mother tongues. They'll apologize for that, but they'll still do their best. So as I said to you, you're not asking us for a favor. You are doing us a favor by asking us to come and talk to you. So that, as I said at the very beginning, you're doing it for all of us, not just for the individual who's being vaccinated. You're doing it for our community and our hospital staff in particular.
Yeah, thank you, Vas. And I'd echo that in terms of these sort of webinars will help support you, educate you, which will then pass that information on to someone in your community. And Barry's got his hands up with the community connectors, so I'm going to pass it over to Barry as well. And certainly the volunteers we got 55 on the books at the moment, and they're seeing firsthand what's happening, so they've been passing information on and also educating the staff as well. So Barry, did you want to add to that?
Yeah, thanks, Mo. And I guess it's kind of to echo that point that we're working really closely with voluntary sector organisations as well. We've commissioned some of those organisations so we can really work with the community to understand concerns and to make sure that we're increasing the reach and the understanding of our messages. We also, every week, we've got 135 community champions in Merton. We meet them every single week. So it's an ongoing dialogue. These are not one-off webinars. These are building ongoing relationships with individuals, with service providers, voluntary sector organisations, and they're every Wednesday. So we'll send the link out because, again, we need to work with those communities, organisations and our residents to increase the reach and effectiveness of our messages. And as Vasa said, if you give us the information, we'll be able to do things with that. So that's really important for us.
Excellent. So true, Barry. And I'm going to sort of pass over to Malik. Malik, did you have any words you wanted to say today?
Thank you, Mohan. I just want to say next time we do these webinars, we should tell people to turn their cameras on because, we live in this strange time, don't we, where we're all hyper connected through this Zoom and Teams. But at the same time, we're also isolated and alone and vulnerable in our own homes and afraid. I certainly am not in a good place often. And I think it's really important that we see each other, we connect each other, we acknowledge each other. And I'm so very pleased to see people and for people to see me and for us to acknowledge each other, because I think that's really important. We are living in a very strange and difficult time. And I think we have to acknowledge that we're living in a strange and difficult time. I also think that a lot of the fears that people have are legitimate fears. Just because people say that they're hesitant to take the vaccine or they're afraid to take the vaccine, they don't believe the vaccine, I think that we should acknowledge that. People are coming from a genuine place. And we shouldn't just label people and say, you're conspiracy theorists or anti-vaxxers or so on and so forth, because they might not be. They might come from a legitimate place of worry and fear. But I just want to say that it's such a movement of us. I think Dr. Vasa said at the beginning, how very pleased we are. Some of us don't see each other, probably don't even say hello to each other on the street. But through this COVID pandemic, we've all kind of got to know each other a bit better some of the time. And I think that it's really the beginning of hopefully us building back better and stronger. We will defeat this virus. All things will pass, and we might be in a difficult period at the moment, but this period will pass. We will come out of this period. And hopefully we'll come out of this period in a better place. And just like what Dr. Vasa said, defeating the pandemic is just one thing. I see all the conversations in the chat about all the other diseases and inequalities and discriminations and difficulties that we have. And hopefully after we've learned the lessons from this pandemic, we can continue these conversations and talk about the other things, not just about the pandemic and the virus and the vaccine, but all the other things that affect us, mental health being a huge, big issue, diabetes, motor neuron diseases, and all the things, cancers that affect us. So I'm very pleased to see everybody, and I'm very pleased to be on this call. Within the next 10 days or so, we're going to have a similar call in Wandsworth with some of our friends and colleagues from faith groups, churches, mosques, temple, and also young people. Our young people, our children, I mean, they are our better futures. And actually, they're the ones who are on WhatsApp and so on and so forth, much more than we are. And we need to bring them into this conversation and address some of their fears and some of their concerns. So thank you, Mohan. And I look forward to continuing solidarity and fellowship with everybody on this call and beyond.
Thank you, Malik. And I think we all echo that completely. This is a legacy we're starting, and actually we can start. This can carry on well past COVID, and actually we built those links, and actually there's a good way of supporting each other. And coming on to connecting, before we move back onto the slide deck, I want to ask if we could all take a picture of all of us. Could we all wave and smile at the? I think it's a fabulous turnout. So thank you. Great. If we can move back on, I think Beck from Health Watch wanted to do just a quick question, and then I think we've got a couple of key messages which will be useful in Merton. So, Aman, do you mind if we flip back into presentation mode?
Yeah, absolutely.
And then Barry, I was going to get you to do the last few, if you wouldn't mind.
Do we want to bring the poll up before doing the last questions?
Yeah, so we do the poll and then we'll do the question.
Beck, would you be able to bring it up for us?
Yeah, can you just stop the share for a moment, please, Aman?
Oh, yeah.
That's all right.
That's all right. Okay, thanks, Mohan. So I'm just going to launch a poll, and basically the poll is just try and gauge where people are sitting in respect of taking the vaccine. So you're going to see in a moment a poll pop up onto your screen. Here we go. And just, it is anonymous. Don't worry, we're not going to have names. I'm just going to, here we go. So the poll's been launched. So from the top, you get one choice. Yes, I always plan to have the vaccine. 2, yes, my view has changed since following this wonderful this wonderful seminar with all the information that's been shared today. No, I never plan to. No, my view has changed following this webinar. Obviously, we hope that hasn't. Maybe following this webinar, I might take the vaccine. So away you go. We've got 50 people that potentially can vote. I think that's everybody, actually. We've got almost. Here we go. And the results, we've had 27 have voted. The poll got closed for some reason after 27 votes. So I'm going to share the poll. Can we just do it one more time? Apologies. And if you are one of the hosts, if you don't press end the polling, is that okay? So we'll do that again. I'm going to relaunch the poll. Okay, go again. So please don't press end polling if you're any of the hosts. Thank you. We're going to keep going up to 19, 20, 25, 26, 27. It's like an auction here. We need 32, 33 have voted, 34. Let's get some more. I have to say the turnout's been amazing tonight, hasn't it, Maya? We've had nearly 50 people at one time on the YouTube live link, and we had over 58 people on here. So we've actually reached out to over 100 people tonight, and that's taken away from all the professionals and all the panel too. Not taken away, but obviously taken them out of the numbers. 40 out of 50 have voted.
Also, Beck, just to add, if anybody wants to do it via the YouTube link, you can put your yes, no, or maybe in the comment box, and we'll pick it up for you.
So we get to 40 out of 50. It seems to have stalled at 40. So there we're going to go. I'm going to end the polling. And now I'm going to share the results just to give you an idea. Can everyone see the results? So actually 75% of people that attended today were planning to have it anyway. You've changed 2 people's minds, panel. 2 people's mind of actually following this. They're going to go for it. And the maybes is actually another 2 people following this webinar, so potentially 4 more people. And no, my view has changed. That's good. That's good, panel. Nobody has changed their view to a no since this webinar. So that's good. That's good news, obviously. So that's it. That is the poll. And hopefully that has been of interest, just seeing how people's mindset has moved along. Thanks very much.
Thank you, Beck. Really, really insightful. And we managed to get 2, so a few more to go. But, we're here to support your decision. We're not here to convert. We're just here to make you aware of everything which is available so you can make that choice. Maybe if we flip back onto the presentation, just a couple of key messages, which, Barry, did you want to do this the last few?
Yeah, sure. Thank you, Mohan. I guess the focus of today's session has clearly been on vaccination because of the importance of that. But the other key thing that we are working with across the borough on our COVID response, and it's really important to say that the NHS, the local authority, voluntary sector, and residents coming together on that COVID response is about testing, and testing is going to be absolutely critical for us as it has been through. And so, if you have any symptoms of COVID-19, however mild, if you're not too sure, we would strongly encourage you to access a PCR test. There's availability across the borough. You'll be able to go online or call 119 to get access to a test if you are symptomatic. We're also within the borough focusing on asymptomatic people. So what that means is that we know about a third, 40% of people with COVID are asymptomatic. So they have no symptoms. So they're going about their daily routines. They're going to work. They're caring for people, and they are shedding the virus. They are transmitting that virus. So we have a network of asymptomatic testing sites. So we would strongly encourage frontline workers, those people that can't work at home, those carers, all those volunteers that are caring for so many people across Merton, to take part in regular testing. This is through an LFT, so it's a fast test. And so again, we'll send the slides out so you can able to access those tests. Next slide, please. They were the key messages.
I thought there was one more. Oh yeah, great.
Yes.
I mean, this one's carrying on. So, whether you've had the vaccine or not, is to continue social distancing, wash your hands, wear your mask, and continue those guidance until otherwise, really. I mean, until we're in a better place than where we are. So yeah, I mean, I think moving on to our next slide, I think that brings us on to a nice natural end. So I'm going to, if you have any further questions for today, please mail the email address there. We are looking at doing further webinars, as we've mentioned, because I think this is just one of many, and we can reach out to more people. We'll be interested to hear what else you think would be useful, certain target groups which might be undecided or maybes. Please do let us know. But I'm going to thank all our panel for coming today and giving us their insights and also supporting today's webinar. Big thanks to Aman and Ben for bringing us together, and Geeta and Malik also, and also Beck as well. So thank you all. Stay safe, and yeah, we'll see you next time. Thank you.
Thank you.